One of the best ways to sight your transversus abdominis is to take your two fingers, index fingers, and you're going to place them on each side of your rectus abdominis, just inside your hip bone, and just put it right against your trunk. Now, one of the first things I'd like you to do is to draw your pelvic floor up very gently. As you draw your pelvic floor up gently, which is called a Kegel, a common pelvic floor exercise, you might feel a tightening under your fingertips. I'm going to relax that contraction, and then I'm going to do it again. I might be able to feel some tightening under my fingers when I'm just drawing up my pelvic floor. Another option is to take a breath in through your nose, exhale through your mouth, and continue exhaling through your mouth through pursed lips, and see if you can't gently activate your transverse abdominis. So here we go. And underneath my fingers, I should feel tissue or muscle that begins to tighten down. Another more obvious way of making this happen is to stimulate the contraction by performing some kind of a movement or creating some kind of a load. So what I'm going to do is I'm going to keep my fingers at my transverse abdominis, and I'm going to take my toe into a point position on the floor, and that effort should ask for more control by this muscle activation. Once again, I'm going to palpate my transverse abdominis, and I'm going to create some kind of a load or motion that will stimulate the contraction. Let me do this on my right foot. I'm going to step as if my toe is in the floor, my heel is up, I have less balance from the outside, and I feel a tightening to each side of my rectus abdominis. That's my transverse abdominis. And I can practice that on one side or the other. Sometimes people will feel that their one side contracts more than the other side. If that's what you feel, there's nothing wrong with that. We know that the transversus abdominis activates directly. So what you're experiencing is a lot of other muscle activity that feels more loud or more apparent because you're putting more demand on those muscles to create that movement. So once again, we have three methods of activating the transverse abdominis. We can use our fingers to feel when and where that muscle is contracting, and we can do a drawing up of the pelvic floor. We can exhale, and we can stimulate it by movement or load. In this case, I'm just making a toe down into the floor, lifting my heel, putting more demand on control, and that control shows up for me.